Hello, welcome to the StellaLife Innovator Series. I'm Liz Lundry, a longtime hygienist and educator, and today I have the honor of interviewing Dr. Jessica Pharar. Dr. Pharar attended the University of Nevada in Las Vegas School of Dental Medicine for her dental degree and completed her dental residency at Texas A&M College of Dentistry. Shortly after she left for her residency, her father was diagnosed with a very aggressive type of brain cancer. When her family began hospice care for her father, she moved back to California to be a part of his full-time caregiver team. After his untimely passing, Dr. She returned to her residency program with a new mission to improve the quality of life of cancer patients by providing compassionate dental care. Her experience with her father made her a true advocate for cancer patients, and she began focusing her practice to treating cancer patients. She sought out to have integrative care for cancer patients and help ensure that they have a much richer quality of life before, during, and after their treatment. So she then founded the Pharar Foundation. So welcome, Dr. Pharar.
Thank you
I,
for having me, Liz.
I'm so happy that you can, share your experience and your message with everybody. I lost my sister to breast cancer, and I know how
Okay,
devastating it is to a family going
right.
through that experience and then watching them suffering. And, with your experience with that, you were by your dad's side as he went into hospice care, and this
Mhm.
really changed the trajectory of your career. Please tell us about that experience and kind of your thought process as you're going through it.
Sure. So I started residency in July, and my dad was diagnosed in October. And like you said, I was in Texas, and my family was back in California still. So I was going back and forth during my program. But my program director had created a very close affiliation with one of the cancer departments at the uh, Baylor healthcare system. And so we were already treating cancer patients as part of our program. So when I told my program director about the situation that my father was in, he said, take what you know and what you've been taught and go apply it on your dad and see firsthand what kind of results you can get from this kind of dental care. And I did. I listened to him. I applied as much as I could considering being in the hospital and whatnot. And I was blown away at how much more comfortable my dad was able to get through his chemo, his radiation. And I realized like this actually can make a huge impact on a cancer patient's journey. And then if they're able to, in their survivorship as well. So after my dad passed away, I went back to my program, and my program director, he has this philosophy that there's three parts to a cancer patient's journey. There's the patient, there's the caregiver, and there's the healthcare provider. And he said that you'd already been a caregiver and now you're the healthcare provider. You'll be a much more empathetic provider because of it. And he was right. When I started seeing the cancer patients again, when I returned to my program, uh, I had a much deeper understanding of what they were going through and understood what the families were going through a lot better. And because of that, I gave 110, not that I don't give 110% to all my patients, but uh, the cancer patients just pulled at my heartstrings a little bit more. And I wanted to do everything in my power to take care of them and make sure that whatever time they had was comfortable and that they had a really great quality of life and especially while they went through their journey. Um, that stuck with me throughout my career. After finishing my program, I eventually moved back to Las Vegas, where I went to dental school, and I decided to dedicate a portion of my practice to taking care of these cancer patients, specifically getting them ready before they start their treatment, supporting them through their treatment, and then supporting them through their survivorship and doing whatever reconstruction that they needed so that they could get back to who they were before they had their cancer treatment.
Yeah, that's it's so fortunate that your residency program, you had those resources with your
Yeah.
program director who really understood and you had that training. So that's incredible how that worked out for you and your family.
Yeah.
So, and you learned that sadly, most dental practices don't provide the type of care that cancer and other medically complex patients need because they're not comfortable with it, needing more support as clinicians, I think. So this
Mhm.
prompted you to start the Farrar Foundation
Mhm.
to provide appropriate care for a variety of different compromised patients. So how does your foundation do that to improve the lives and the journeys of these people while they go through their treatment?
Yeah, so our foundation actually takes a two-pronged approach. One is we provide the direct patient care, and then the other part of it is we do empower medical and dental providers to feel more comfortable working with these patients. We work with medical providers to teach them about how important dentistry is in their field and how dentistry makes a huge impact on what kind of care they're able to provide, and the outcomes of their care can be vastly improved if you integrate the dental part to it. We also educate dental providers, so hygienists and dentists, to empower them that this is in your purview. You can care for your patients this way, and you don't have to be afraid. I had a lot of patients tell me when I first moved back to Las Vegas that, oh, my dentist just told me to do my treatment, and then when I'm done, come back and like pick up where we left off. And by then, the damage is done. Cancer treatment is really hard on the oral cavity. And if we're not able to support the patient while they're going through their treatment, uh, we're kind of starting from an uphill battle. We can do so much more if we're in the preventative phase of care instead of trying to chase our tail and catch up once the damage is already done. As far as what kind or how we do our direct patient care, I was fortunate enough to do a advanced education in general dentistry residency. One of the other dental providers in our organization did a GPR, or general practitioner residency in a hospital. So we're fortunate that we have a very broad education in the medical management part of patients, because we did have that inpatient experience being in the hospital. We're much more comfortable managing very sick patients. Um, in residency, we saw, you know, everything. There wasn't anything that didn't get provided by us. So it helped us feel very confident in managing these patients. Um, and hopefully we can continue to educate people so that there is less siloing between the medical and dental community, and that we can have a better communication and overall improvement of patient outcomes through working together.
Yeah, absolutely. I would really like to see more courses available, continuing education courses for doctors to be able to learn about protocols and things, because unless they've had the kind of training you had in a residency program, they, don't have that support. So that
Yeah.
would be great.
Yeah.
And of course at StellaLife too, we really appreciate how uncomfortable it can be and how many
Mhm.
people quit chemotherapy because their mouth hurts so much they can't eat. So this
Right.
cause is really close to our hearts. So we do
Mhm.
donate products to cancer patients who can't afford them,
Mhm.
so they can get through their treatment comfortably and be able to nourish themselves, because that's a huge obstacle as they're going through these treatments. So what can we do as dental professionals, to provide better care? How can we learn more? And what do you suggest that we all do?
For sure. So I actually attend a lot of cancer summits because I am trying to educate other providers on how to care for these patients. And with cancer medications, there's a new one, I feel like, every month. So there's a lot of having to stay on top of it and keep current with things. Um, the biggest thing that I tell physicians and dentists is talk to each other.
Yeah.
Um, you both are experts in your respective fields, but you don't know what the other one knows. Talk to each other. pick up the phone. Pretty much every oncologist, oncologist, surgeon that I work with, I have in my cell phone. I'll text them, I'll call them. Um, Patients benefit when you talk to each other. If we have to stop chemo for any reason, I don't want to go through the mire of trying to call a nurse practitioner or a PA and hopefully someone will call me back and timing. No, just talk to each other directly. You both are working towards the same goal, getting this person healthy. So there's no reason that you shouldn't talk to each other. You're on the same team. Um, it makes a huge, huge difference for the patients. Um, Once you start talking to each other, ask each other questions. I just did a lecture a couple weeks ago with a, a speech pathologist and a dietitian about how we can work with cancer patients together. And I was blown away at some of the stuff that they can do. And I had no idea. And if we don't talk to each other, we'll never know how we can help each other as providers. Um, that's probably the biggest thing. Don't be shy. Talk to other dental providers. If there's somebody you know who maybe has more advanced training than you, talk to them. I work with a lot of oral surgeons or dentists and physicians. If I'm ever not confident or something, or I'm not really sure, I'll talk to them. I'll get their idea, get some feedback. Uh, just like in dental school, hit the literature, read about it, read what's new, what's current, how are modern approaches. Um, there's so much information out there. We provide ourselves as a resource, especially in our local dental community. If there's ever a case or a patient that a provider is not comfortable with, we're happy to manage them for them. And we invite the doctors to come watch how we manage their patients. So you can build that confidence of like, yes, I can do this. This is totally in my wheelhouse. And as general dentists, it is in our wheelhouse to take care of these patients. You know them so much better than their oncologists do. Um, and you can be that bridge for them.
Yeah, and it's really all about communication, and that's something that I think the medical dental, caregiving community really needs to focus more on to have that communication. Because, like, as a clinician, maybe I haven't had all the training, or I'm in the process of learning about what I can do for these patients. But the easiest thing to do would be to call that patient's oncologist,
Yeah,
because each case is different. So there will be different medications, different treatments used. So perhaps what we do as clinicians is not always going to be the same with
right.
each one. So I think by having that as a first step, which isn't difficult to do, really,
Yeah,
and can be integrated into what we do every day immediately. So thank you
yeah,
so much
of
for
course.
sharing your story. Our heart goes out to you and your family
Thank you.
for your loss.
Thank you.
But you're bringing so much hope and comfort to so many people with what you're doing now. So I'm sure your father's really proud. And
Thank you.
thank you for all you do. Thank you,
Of
everybody,
course.
for joining us today and learning more so we can all be better at what we do and take better care of our patients. So please come back next time for our next Innovator Series. Dr. Pharar, thank you again. Everybody, take care, stay well, and stay happy.